Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm going to talk about genital infections, which is one of the most problematic infection faced both male and female. But in fact, most women experience minor vaginal problems from time to time, more than males. And this may be as a result to menstrual cycle, sex infections, birth contact method, and sometimes change after pregnancy lead to change in normal vaginal microbiota. And one of the first and most signs associated with bacterial vaginosis is changes in secretions. And sometimes this infections is associated with change in urination, such as burning feeling and pain during urinations. So, genital infection in female, including vaginal infection, infection of the female pelvis, post-gynecological surgery infection, pelvic inflammatory disease, while in male, prostatitis, epididymitis, orchitis, urethritis, and balanitis. Genital infection which sometimes refer as reproductive tract infections, including three types: sexually transmitted disease, endogenous infection, iatrogenic infections. Sexually transmitted disease such as chlamydial infection, gonorrheal infections, and chancroid caused by Haemophilus ducreyi, while endogenous infections caused by overgrowth of organisms normally present in genital tract, mainly in vaginal mucosa of healthy women, which lead to bacterial vaginosis, while iatrogenic infections occur after some medical procedures, improper medical procedure, such as use of such as in case of unsafe abortion or poor delivery practice, while in case of male reproductive tract infections, the following cases can occur, which including prostatitis, epididymitis, orchitis, cystitis, and other reproductive male infections. Many etiological agents can lead to vaginal infections. Normal flora, Candida species, which causes candidiasis, Trichomonas vaginalis, which is a parasite that leads to trichomoniasis, bacterial vaginosis, staphylococcal infection, which result from toxin produced by Staphylococcus aureus, causes toxic shock syndrome, foreign body vaginitis. Some viruses can also lead to vaginal infections, such as herpes simplex, human papilloma viruses. Vaginal mucosa harboring many microbiota, but the most common bacteria that are found in vaginal mucosa, including lactobacilli, Streptococcus viridans, some species of non-coagulase or coagulase negative Staphylococcus, such as Staphylococcus epidermidis, and also some anaerobic bacteria such as Bacteroid and Brevotella species, also Gardnerella vaginalis found in vaginal mucosa in a ratio about 30 to 90% of vaginal mucosa in women. Staphylococcus aureus also may be found in vaginal mucosa, and of course Candida species or yeast, it is also present in vaginal mucosa of women. One of the conditions or factors that offer or provide favorable conditions for microbiota to survive and overgrowth in vaginal mucosa is a vaginal secretions, which is a mixture of liquid cells and bacteria that lubricate and protect vagina from the infections. This vaginal secretion is follicular and contain no bubbles, and the most bacterial microbiota found in this vaginal secretions is lactobacilli, which can protect from the infections with other bacteria by providing hydrogen peroxidase system. Bacterial vaginal infection, which is sometimes referred as bacterial vaginosis because the causative agent is restricted to bacterial infections. There are a relation between Gardnerella vaginalis and other microbiota found in vaginal mucosa that causes bacterial vaginosis, such as Lactobacillus, Brevotella, and some anaerobic bacteria such as Bacteroid species. And in addition to that, other bacteria that also lead to bacterial vaginosis found a relation between in the presence of Gardnerella vaginalis with these bacteria such as Mycoplasma hominans, Urea plasma, Urea liticum, and other bacteria associated with bacterial vaginosis. Bacterial vaginosis, including interactions between lactobacilli and other bacterial microbiota found in vaginal mucosa with Gardnerella vaginalis. And as we know, these microbiota cannot cause symptom or infections or negatively affect pregnancy, and it is mainly dominated by lactobacillus species. So the bacterial vaginosis is a synergistic infections involving not only Gardnerella vaginalis but other anaerobic bacteria. Scientists found that numbers of anaerobic are dramatically increased in women with bacterial vaginosis. As a result, this increased as a result to other due to aromatic amines produced by anaerobic bacteria such as Bacteroid and Bovotella. These aromatic amines lead to reductions in lactobacilli species, which allow Gardnerella vaginalis and other anaerobe to thrive in vaginal mucosa. So this equilibrium in the vaginal microbiota, which with decline in the number of lactobacilli, while the infection involves a number of bacteria, it is believed that the most infections start with Gardnerella vaginalis, creating a biofilm which allow other opportunistic bacteria to thrive in vaginal mucosa. Bacterial vaginosis can lead to many complications, but the most important complications including amnionitis and premature labor and delivery, late-term miscarriage, postpartum fever, salpingitis, and sometimes vaginal cough cellulitis can be associated with or can be complications of bacterial vaginosis, which is an infection of superficial tissue of the vaginal surgical margin after hysterectomy. Sometimes bacterial vaginosis lead to septicemia. Diagnosis of genital infections have some obstacles because the clinical features are not always specific, and many infections, mainly in women, are asymptomatic, and sometimes laboratory tests not always reliable, and mixed infections sometimes occur in both male and female. So the diagnosis of bacterial vaginosis is including vaginal examination in addition to macroscopic examination, which is vital to the clinical diagnosis in bacterial vaginosis. There are two criteria for diagnosis of bacterial vaginosis. First, called EMSL criteria. This criteria including thin, white, yellow, homogeneous discharge, and also the presence of clue cells on microscopy. So the presence of clue cells in microscopy in addition to thin, white, yellow, homogeneous discharge, in addition to that, vaginal pH less than 4.5, and whiff test, which whiff test must also be positive. So whiff test, which is also must be positive. Whiff test, also called amine odor test, which is release of a fishy odor. Release of a fishy odor indicate positive whiff test. It is this test performed by adding 10% potassium hydroxide to a vaginal discharge. When the release of fishy odor, or this means this test is positive and the infection is bacterial vaginosis. So it is this test differentiate between bacterial vaginosis and candidiasis or Trichomonas vaginalis infections. So EMSL criteria including thin white yellow homogeneous discharge, presence of clue cells, pH of vaginal below 4.5, and in addition to that with test positive. When all these criteria found that give any clue the infection is bacterial vaginosis. Some at least 3 or 4 criteria should be present to at least 3 or 4 criteria or this 4 point should be present to confirm diagnosis of bacterial vaginosis. Today, a modification of the EMSL criteria accept the presence of 2 criteria, 2 point or 2 criteria instead of 3 factor to be equal or to be considered these infections are bacterial vaginosis. In previous criteria, I mean EMSL criteria, gram stain not included. But in the second criteria, which is called Nugget criteria, the interpretation of direct gram stain which is performed from vaginal secretion or high vaginal swab, the interpretation of gram stain, it is important and to be considered this infections bacterial vaginosis or not. This criteria called Nugget criteria. In grade 1 Nugget criteria, lactobacilli are predominant. So when the lactobacilli predominant, that means no bacterial vaginosis, while when some lactobacilli present but Gardnerella and Moblincus found, that means intermediate bacterial vaginosis, while in case of grade 3, when few or absent lactobacilli found in gram stain but Gardnerella or Moblincus predominant, that means bacterial vaginosis. Put in your mind, Moblincus bacteria are gram-negative anaerobic bacteria, and sometimes it is considered as gram-viable. That means sometimes it is take gram-negative, but sometimes it is gram-viable, gram-negative to gram-positive. In this figure, you can see clue cells, which is an important point in EMSL criteria. Clue cells, it is an epithelial cell. Epithelial cell studied with tiny cocobacilli, مرصعة بالcocobacilli, studied with tiny cocobacilli. That means when you found this cells, clue cells, that indicate the infection is a bacterial vaginosis. In genital infection, whatever are the types of genital infections, I mean male or female genital infections, what preparation and gram stain, one of the most practical and simple method to give a clue to diagnosis genital infection, because the gram stain you can observe in case of bacterial vaginosis, you can observe cluseals, while cluseal, in addition to intracellular gram-negative diplococci and gram stain, it is an important and confirmatory test in case of male gonorrheal infection, because any gram stain when you take urethral discharge from male, you can observe gram negative diplococci. And in what preparations you can see bast cells, yeast cells, and trophozoite of Trichomonas vaginalis. So this two methods, it is a simple and practical method in diagnosis of genital infection. In case of male genital infection, prostatitis, epididymitis, and orchitis is the most common complications of this infection. Prostatitis can be caused by gram-positive streptococci, while orchitis can be caused by gram-negative bacteria such as E. coli, Klebsiella, and gram-negative and gram-positive can causes genital male infections. And thank you.